We're going to look at the muscles that make up the anterior body wall. Now, the first step in this dissection is to reflect the pectoralis major muscle, and the easiest way to do that is to find the inferior margin of the muscle and then run your hand medially, and as you're doing that, cutting off the muscle from the underlying ribs and from its attachment to the sternum and also to the clavicle. And this will allow you to then reflect the muscle in this manner. And you'll notice that you don't have to worry about destroying any of the nerves or the arteries because they're all going to be found on the underside of the muscle. Once you've reflected the pectoralis major from either side, you'll reveal the pectoralis minor. It's attached to the ribs on the anterior rib cage. You should cut along its margin of attachment and also reflect this muscle as you have the pectoralis major. Having done this, this will reveal the bony thorax, showing the ribs right here in the intercostal spaces, which are filled with the intercostal muscles. I just finished cutting the block of the intercostal muscles out from several of the ribs here, and I've also broken the ribs with a pair of pliers so that I can remove a segment of them. And after removing a segment of the ribs, about a finger's breadth lateral to the margin of the sternum right here is a long blood vessel which is coursing from the subclavian down along the inner surface of the ribs. This is the internal thoracic artery. It's accompanied by the internal thoracic vein. As this artery courses down the underside of the thorax, it is sending slender branches to each of the intercostal spaces, so that arising from the internal thoracic artery are going to be an anterior intercostal artery which will supply each intercostal space. The next step is to reflect the external and internal and transversus abdominis muscles. And the best way to do that is to initially start by finding the upper margin of the external oblique, which is right here. The fibers are oriented in this direction, coming towards the midline, and we're going to cut these fibers as we see them end in their tendons right here, from about here down to the level of the umbilicus. So I've inserted a pair of scissors on the undersurface of this muscle so that it will guide my cut as I come down. Now, I've just completed the incision of the external oblique all the way down to about the level of the umbilicus. We don't want you to go any further than that because we have an important area down in here, the inguinal area, that we'll be studying later on. I have separated the external oblique from the internal oblique by doing a blunt dissection. There's some fine connective tissue, and it's very easy to separate the two once you've found the plane. Furthermore, I have identified the internal oblique by the direction of its fibers. Don't forget that the external oblique fibers came down in this direction. The fibers of the internal oblique are at right angles to that, so that they are coming in this direction. Likewise, I've also cut along this margin of the internal oblique. It's a very thin muscle, so don't cut very deep. And once again, I've done a blunt dissection beneath the internal oblique so that I can reflect it and expose the underlying transversus abdominis muscle. Now, in the fine connective tissue between the second and the third layer, we find these nerves running here. These are intercostal nerves which have continued down onto the abdomen, and these are the nerves that are innervating these muscles. So you will see these appearing in a regular fashion, and so far I've uncovered two of them here, and we would expect to find another one down here. So those are the three layers of the abdomen that you should carefully reflect in this manner: external oblique, internal oblique, and finally the transversus. Okay. Now, to complete the dissection, we're going to look at the rectus abdominis muscle, and it is found within a compartment which is made up of something called the rectus sheath, and a portion of the rectus sheath is made up of this thin connective tissue. It's really a tendon, and it's really contributed to by each of the muscles that we dissected just a minute ago. That is to say, as the external and the internal and the transversus abdominal muscles come towards the midline, the fibers stop, and their tendon is really a very thin, flat tendon. Well, that tendon, as they join together at the lateral margin of the rectus muscle, now splits to form a little pocket in which the rectus muscle lives. So we are now cutting the anterior margin of that rectus sheath, and we've done that down the midline of the rectus muscles on the one side. So this is the midline here. There's a rectus muscle over here, and then there will be another rectus muscle on the other side within its own rectus sheath. So that there's an anterior lamina or portion of the sheet, and then when we look behind the muscle, you see there's a posterior lamina. So this muscle really lives within an envelope within this connective tissue. So we've cut it along its external surface, and we have reflected it away from the rectus muscle. Now the rectus muscle is really composed of several muscles which have come together secondarily. They're really separate muscles, and that's what gives rise to these tendinous inscriptions that you can see here. And in fact, these tendinous inscriptions are what we recognize as the so-called six-pack, because if this muscle were to hypertrophy, it gets large here and here and here. Since the rectus muscle is really made up of separate components, one would expect to find that there would be more than one nerve coming to this muscle. Now we saw the nerves previously traveling between layers 2 and 3, coming around the body in this manner, so that the expectation is that those nerves would continue into the rectus muscle on its lateral margin. And of course that's why during surgery you would not enter the abdomen by making a long incision along here, because you would cut each of these nerves and paralyze the rectus muscle. So that one way of entering the abdomen is actually to cut the anterior portion of the rectus sheath, reflect that, and then you take the muscle and you always push it towards its innervation. And then you would cut the posterior lamina, and then you would be able to get into the abdominal cavity. One of several approaches into the abdominal cavity. Now the other feature about the rectus muscle is its blood supply, and just as we saw with the pectoralis major when we reflected it, the blood supply and the nerve supply are actually on the undersurface. So I've cut the rectus muscle here, and on either side you can see there's a fairly large size artery that runs within or along the undersurface of the rectus. Now where do these arteries come from? The internal thoracic artery that we saw up here giving off the anterior intercostals continues on down below the margin of the rib cage and continues on the undersurface of the rectus muscle. It changes name. It's the same vessel, but it changes name, and it becomes known as the superior epigastric artery. Likewise, there is another artery which arises from the external iliac, that is the end of the aorta, and it arises and comes up on the undersurface of the inferior portion of the rectus muscle, and they meet somewhere in the middle. And the meeting of these introduces the concept of anastomotic connections. That is to say, if you were a blood cell and you were traveling up in the inferior epigastric, it would be possible for you to continue your travel without even knowing it and transition into the superior epigastric artery and continue on up. So that overall, these vessels represent a site for collateral circulation. That is, it would be possible for the upper portion of the rectus to actually receive its blood from the lower stem, that is the inferior epigastric.
As you first start your dissection of the back, you will clean up any subcutaneous tissue, and the first muscles that you see are not true back muscles, but are called extrinsic back muscles, because although they're located within the back, they're going to exit the back and move the upper limb. Some examples of those muscles would be a large muscle in the upper back called the trapezius, and if you reflect the trapezius muscle, you will find additional limb muscles deep to it, including the rhomboids and the levator scapulae muscle. All of these muscles will be reflected to see the true back muscles that move the vertebral column. Lower in the back, we've got, again, a very large muscle that moves the upper limb called the latissimus dorsi muscle. And again, you will reflect these muscles on each side to really get to the muscles that we're interested for this current dissection. Just to give you a better idea of how we reflected these superficial muscles, you simply need to take your scalpel and make an incision along either side of the midline. That is the primary attachment of all these extrinsic back muscles. And by doing that and getting your hand deep to the muscle within a plane of some loose connective tissue, you'll be able to separate that muscle from the deeper ones and then simply reflect it back and out of your way. Okay, again, we're going to reflect the extrinsic back muscles so that we can get to the intrinsic back muscles, which are responsible for moving the vertebral column. Okay. Now there are several groups of intrinsic back muscles, and they've got very complicated attachments, but we're going to simplify it. If you first look at the muscle group in the lower back, you're going to see that there's a huge mass of muscle running vertically along either side of the column. This is called the erector spinae group of muscles, and you may read about different subdivisions to this group. We're not going to get into that detail, but simply talk about the erector spinae group that forms a large mass on either side of the vertebral column. Okay. And again, by just taking a scalpel and cutting down on either side of the spinous processes of the vertebrae, and then using a chisel to scrape that muscle away from its other attachments, you will be able to reflect that entire group of muscles to expose the vertebral column itself. Okay, so this is the erector spinae group of muscles that's particularly well developed low in the back. Okay. If we now go up to the cervical region or the neck region, you'll find some additional intrinsic back muscles. The most superficial group at this level would be a muscle called the splenius capitis muscle. And if you take a look at the orientation of the muscle fibers here, you'll see that they essentially form a V on the back of the neck. The fibers are angling from the midline upward and laterally as they approach and attach to the skull. Okay. Again, by cutting along the midline, the attachment of the splenius muscle, you can find a deeper group of muscles. Okay. Now again, if you take a look at the orientation of the muscle fibers, you'll see that these are running more vertically along either side of the column. And this muscle is called the semispinalis capitis. All of these back muscles are going to be responsible for extending the spine and also for rotational movements of the spine. Now, as an orientation to what you're going to be doing in the next step of the dissection, we've got an articulated vertebral column here, just so you can appreciate some of these surface landmarks that you see on the cadaver. Now, these bony processes that are extending out posteriorly are the spinous processes right on the midline. Those are for muscular attachment. And then if you look closely at these vertebrae, you also see additional processes, the transverse processes, again serving as muscular attachment points. Now, you might need to look a bit more closely to see that there are joints between the pairs of vertebrae here at each level. So there is a limited amount of movement at each intervertebral joint. This is an isolated vertebra to show you some of the parts that you're going to be removing, cutting through during this next dissection. This is the body of the vertebra. You're going to find that on most of the vertebrae along the column. And then there are some portions that form the boundaries of this vertebral canal, the spinal cord being housed and protected within the vertebral canal. Now what you're going to do to expose the spinal cord and its branches is to cut through the bone of the vertebral column and remove it so that you can see inside. Okay. The part of the bone that's attached to the body and extends posteriorly is called the pedicle. And then the portion of the vertebra that forms the roof over this vertebral canal is the lamina. Where the two laminae meet, that's where the spinous process forms, and where the pedicle and lamina meet is where the transverse process forms. You're also able to see the articular processes that will form joints between the sequential vertebrae. Now, one thing to pay particular attention to is the size of the vertebral canal. It's about 1 centimeter in diameter, so as you're making your saw cuts through the laminae on the cadaver, you need to be certain not to make those cuts too wide. For example, if you get a little bit too wide with your cuts, you may only be cutting off the transverse processes and doing nothing to get into the vertebral canal and expose the spinal cord. So I would estimate that about 1 centimeter wide would be what you're going to cut and remove from the vertebral column to expose the spinal cord. Here are the spinous processes of the vertebrae, and your goal is to remove the spinous processes and laminae along the entire length of the vertebral column. So the first step in this process, after you've cleaned away as much of the soft tissue as possible, is to take a saw and score along the entire length of the vertebral column, just lateral to the spinous processes, cutting through the laminae. Okay? And this should ensure that you expose the spinal cord and the surrounding tissues without going too wide. After you've done that initial saw cut, which should be relatively shallow, you want to finish the removal of the laminae by using a chisel and a hammer. So angle the chisel in medially and then use the hammer to continue going through the bone and ultimately remove the vertebral column piecemeal along the entire length, and you will expose the spinal cord and surrounding meninges within. We've completed making the cut through the laminae along the entire length of the vertebral column, including down into the sacral region. So you may or may not be able to pull the entire portion of tissue off in one piece, but in this case we can. So now we're removing the laminae and the spinous processes of the vertebral column. Now what you see inside is not the spinal cord immediately, but some of the tissue that surrounds the spinal cord, one of the layers of the meninges, the dura mater. Okay. And if we incise that, we can see the other two layers of meninges inside this and see the spinal cord itself. It's very easy once you get into the dura mater to simply slit the entire length of it open with the scissors or even a probe. And now, pulling the edges of the dura mater aside, you can start to see some of the other meninges surrounding the spinal cord. Okay, the next layer that we would encounter is the arachnoid, and that is this very flimsy layer that is collapsed onto the surface of the spinal cord that you can just barely see. It's very delicate, and it is collapsed away from the dura mater because the fluid that normally holds it there is no longer present. By removing that, now you don't see anything distinctive as the innermost layer of the meninges, the pia mater, but that would be attached directly to the surface of the spinal cord itself. As you get into the vertebral column and want to look at the meninges and the spinal cord, it's helpful if you cut away some of the dura mater and reflect it out of the way so you're not constantly having to hold it back and out of your way. As you do get that revealed, again, you'll see the arachnoid, which is collapsed on the spinal cord, and we have dissected some of that away. But one thing that's striking as you look at the spinal cord itself is that it's significantly shorter than the vertebral column. In fact, it ends approximately at vertebral level L2, so that as we look at the spinal cord here, it becomes narrower and narrower at its inferior end, forming a structure called the conus medullaris, this inferior cone-shaped structure. Extending directly off the conus medullaris, you're going to find a strand of tissue called the filum terminale. That is a specialization of the pia mater, which anchors the spinal cord to the coccyx and runs inferiorly within the vertebral column to do so. Some of the other structures that you see mingling with the phylum Terminale here are collectively called the cauda equina, and they are dorsal and ventral nerve rootlets that will form spinal nerves forming at sequential vertebral levels and exiting the vertebral column so that the entire body receives innervation. Now if we go back up to slightly more cranial levels, we can see how each spinal nerve is constructed. Now zooming in here at the spinal cord itself, we can see these strands branching from it. Now of course we're looking from the posterior or dorsal side, so what you see first are the dorsal root. Those would be sensory nerves or contain sensory information going back to the spinal cord, and you can also get a glimpse of the ventral root, which branch from the ventral or anterior side of the spinal cord carrying motor information. Now at this particular level we've got a very nice example of another specialization of the pia mater called a denticulate ligament. This also helps to anchor the spinal cord and hold it in position, and the denticulate ligaments come off the lateral edge of the spinal cord, run right through this space and anchor the spinal cord to the dura mater. It's nice to use those as a landmark because you're going to find them separating the dorsal rootlets, the sensory rootlets, from the ventral rootlets or the motor rootlets. Now let's follow those dorsal and ventral rootlets away from the spinal cord, and ultimately they will come together to form a spinal nerve from this level. Following them away from the spinal cord, as you get to the position of the intervertebral foramen, there's a swelling here which represents the dorsal root ganglion, and that is where the sensory nerve cell bodies are found for those axons that are traveling within the dorsal root. Now following away even further, you're going to find the major branches of the spinal nerve. The spinal nerve itself, where all the motor and sensory fibers are together, is very short. It's about right here, maybe a couple millimeters long. And immediately what you're going to find is that spinal nerve branches into a dorsal ramus, which is quite small because it only innervates the deep back muscles or the true back muscles and provides cutaneous innervation as the posterior cutaneous nerve. The ventral ramus is much larger because it's got a much greater territory to supply. This is the nerve that wraps all the way around the body wall, gives off the lateral cutaneous nerve that you saw in the last dissection, and also the anterior cutaneous nerve that you saw in the previous dissection. The other structure that we can find here is a nerve that you see heading straight anteriorly. Now we can't really see what it connects to, but just keep in mind for now the position of this branch and the fact that it's called a communicating ramus, which will link this spinal nerve to the sympathetic trunk, part of the autonomic nervous system. We've used a scalpel to cut a small section through the upper thoracic level of the spinal cord, and you can see the small size of it relative to a dime. Pretty amazing what your spinal cord does for you for its size. And the structure that you see in the spinal cord is actually pretty limited. You can see the distinction between the gray matter and the white matter. Confusingly, the gray matter is central and it looks lighter in the embalmed specimen, and the white matter, which is around the perimeter, has a darker appearance to it.